Hello everyone, my name is Harsha Rautela and today we are going to complete the third part of this topic, that is liver. Sorry for the delay. And priorly we have already completed the two parts in which we have almost covered all the major portions of the liver, and now we will be doing the leftover parts, that is the last part, which is about the blood supply, nerve supply, lymphatic drainage, and all that stuff. Okay, so priorly we have discussed about the general anatomy of the liver, the external morphological features, the internal features, including its ligaments, all its connections, and everything. Now we'll move on to the last part, which is the blood supply. So let's start. For I would like to tell that if you have any queries regarding all the topics which I'm covering over here, you are free to put it in the comment section below, or into the community post in any of the posts which I post over there. And yes, so let's start. First is the blood supply. So, as you know, that liver is a highly vascular organ. Since it is the highly vascular organ, so it receives blood from two main sources. Okay, there are two main sources from where it actually receives the blood supply. So, one is the arterial blood, and one is the venous blood. So it is arterial blood. Thus, it is supplied by the hepatic artery. Now, you remember when we have completed or when we have studied about porta hepatis. At that time, I have told you that there are certain vessels which are going into the porta hepatis, and some of them are coming out of the porta hepatis. So at that time, I have told you about the hepatic artery and the portal vein. So that we'll be studying over here. So there are two main sources of blood supply for the liver. One is the hepatic artery, and one is the portal vein. So the arterial blood which is supplied to the liver, is by hepatic artery. And how much is the oxygenated blood which is actually reaching the arterial blood which is reaching the liver is only 20%. Okay, so it provides 20% blood to the liver, and this 20% blood is what? Oxygenated blood. We know that arterial blood is oxygenated blood. Then second one is venous blood. Now venous blood is being supplied by the portal vein. We know portal vein, and 80% of the blood is received by the liver, and this 80% blood which is received is deoxygenated blood, since venous blood is what? It is deoxygenated. Clear? Next is venous drainage. So this was about the blood supply. Then it is about the venous drainage. Now what is venous drainage is, so it is done by the three main hepatic veins. Okay, it is done by three hepatic veins. Now this part is important. Just listen it very carefully. Okay, this is done by three hepatic veins. Remember, first, left hepatic vein, middle hepatic vein, and right hepatic vein. I'll repeat again. Listen it carefully. Left hepatic vein, middle hepatic vein, and right hepatic vein. All of these three hepatic veins open where? They open into the inferior vena cava. Very important. Left hepatic vein, middle hepatic vein, and right hepatic vein open in inferior vena cava. Clear? Now, again, listen very carefully. There are two conditions over there. First condition is the three vein may enter the IVC independently. The word over here, independently, is very important. I'll do it with the pencil part. Wait. The word independently is very important. The three veins may enter the IVC independently, but listen, the left hepatic vein, okay, the left hepatic vein and the middle hepatic vein usually join. so that only two major veins, okay, only two major veins, clear, only two major, left hepatic vein and middle hepatic vein usually join, so that only two major veins join the IVC. See, there are three veins, one is left, one is right, and one is middle. Okay? All of these drain into a single vein, which is the IVC. This is condition number one. Second condition that may occur is that this left hepatic vein and this middle hepatic vein will merge together, okay, and they will form a separate vein like this, and then this right hepatic vein will join like this, and then they will independently three of them will merge into the IVC. This is the second um, condition. ठीक है? So venous drainage occurs by three hepatic vein, left hepatic vein, middle hepatic vein, right hepatic vein, and they will open into IVC. Either all the three veins will independently open into the IVC, or the left hepatic vein and the middle hepatic vein will join, and then they will open as two major veins into the IVC. Clear? Any doubts? Now we'll move forward. So we have completed the arterial supply, sorry, the blood supply, the venous drainage. Now let's see what is the nerve supply. The sympathetic fibers are derived from colic plexus, and remember, when we were studying stomach, I have mentioned about the colic plexus. You can refer the stomach playlist in this channel itself. Okay, the sympathetic fibers are derived from the colic plexus and they run along the lesser omentum to enter the porta hepatis. Sympathetic fibers are derived from colic plexus and they run along the lesser omentum to enter the porta hepatis. Parasympathetic fibers, remember, this is about sympathetic fibers. Parasympathetic fibers are derived from anterior vagal trunk. Okay? Parasympathetic fibers are derived from anterior vagal trunk and reach the porta hepatis through lesser omentum. Okay? This is about the nervous supply. So these are the three things. Now next we'll move on to the hepatic segments. Okay. Now what is hepatic segment? Hepatic segment is actually the structural unit of liver. Okay. Now the liver has two lobes, right? We know one is the right lobe and one is the left lobe. So the left lobe is actually divided into two parts. Okay, left lateral, which is denoted by A, and left medial, which is denoted by B. ठीक है, वैसे ही right lobe is divided into right anterior by C, which is this one, and right posterior by D, which is this one. ये clear हुआ? Left lateral A, left medial B, right anterior C, and right posterior D. Clear? इतना इधर तक का स्ट्रक्चर क्लियर हुआ. अब वी विल bifurcate it further. See, अब जो हमारा लेफ्ट लैटरल है ना, ए, लेफ्ट लैटरल ए को मैंने और दो पार्ट्स में डिवाइड किया. लेफ्ट लैटरल सुपीरियर, विच इज वन, लेफ्ट लैटरल सुपीरियर, देन आएगा लेफ्ट लैटरल इंफीरियर, विच इज टू, देन बी लेफ्ट मीडियल सुपीरियर थ्री, एंड लेफ्ट मीडियल इंफीरियर फोर. ठीक है, देन राइट right anterior superior 5, right anterior inferior 6, then right posterior superior 7, and right posterior inferior 8. Clear? The fissures for ligamentum teres and ligamentum venosum make junction between the medial and the lateral segment of the left lobe. Clear? So these are the hepatic segments. Now it is the liver clinical anatomy. So, clinical anatomy, remember one thing, whenever you are writing any answer in anatomy, it always has to means has to, any kind of GIT, respiratory, endocrine, or sensory, any kind of thing that you get to like answer in the question paper, you have to always end it with a clinical anatomy as a conclusion. So for that purpose, this is the clinical anatomy. At least 4 points you have to mention in your answer at the end. Okay, so let's see for liver. First is hepatitis. इसके बारे में you all have read, right? Hepatitis, inflammation of the liver, infective hepatitis. There are two types which you will read, which you will get to know next year in pathology. There are two types. One is infective and one is non-infective and amoebic hepatitis. Next is liver cirrhosis. In conditions like malnutrition, liver tissues undergo fibrosis and shrink. Again, there are two types: alcoholic and non-alcoholic liver cirrhosis. Liver biopsy, this is actually a kind of diagnosis method. Then there is liver is the common site. This you can remember, liver is the common site for metastatic tumors. Then we have Pringle maneuver. What is Pringle maneuver? Where hepatic artery and portal veins lie in free margins of the liver omentum. If bleeding in liver occurs, it can be stopped by compressing the free margins of the lesser omentum. This is called as Pringle maneuver. Liver resection, it is done for primary and secondary tumors. 80% liver can be removed safely and liver regrows within 6 to 12 months. Liver transplantation, this is the end stage liver disease. Sometimes segment 5 and segment 8, we have read it earlier, are removed from a healthy person and transplanted. This is important, with segment of the liver. इसीलिए हमने segment liver पढ़ा है, ठीक है? तो fifth and sixth segments, sorry, sixth नहीं, fifth and eighth segments are removed from healthy person and transplanted into the needy patient. Portal hypertension, transjugular intraparenchymal portosystemic shunt. This is tips. You can further read about it into the books. For clinical anatomy part, you can write this much. Then in severe cases, balloon catheters are introduced from the jugular vein into the superior vena cava, then into IVC, hepatic vein, liver tissues, and portal branch. So this is all about liver. Here we have completed about liver. Next, we'll be starting with another GIT organ. Till then, stay updated with this channel, and videos will be put on regularly. And yes, till then, stay safe, study hard, and if you like my series of this anatomy lectures, do like, share, and subscribe this channel. Share it with all your batchmates, your friends who are all into this medical field, and who find anatomy a kind of difficult. Actually, it's not a difficult subject. So yes, you can follow me even on my Instagram handle, which I have mentioned into the description below. Thank you.